into delegation. So this is actually in class where I was actually going to start, because I think that this is probably the most important piece, and truly there is some key concepts that you're going to need to be familiar with this with delegation. So one of the key principles with delegation is we actually will transfer the authority and responsibility to another team member to complete the task, whatever I have delegated. But I, as the person who has delegated that, actually remain accountable. I am ultimately responsible for what has been delegated. So again, delegation is I transfer the authority, the responsibility to another team member, but I remain accountable to that. Okay, so that is a very important concept. So again, delegation helps with time management, helps give cost-effective care, helps further someone else's learning. And again, we have to learn that we can't do everything. Now, I'm sure all of you have seen there's nurses who delegate everything, and then there's nurses who are a little bit on the control freak side that don't delegate a thing. Now, all of you, this is one of the skills that you actually haven't had a lot of experience working with in the clinical setting, just because the way clinicals are set up, and it's something that you are going to have to do quite frequently after you graduate. So there's a lot of rules that relate to delegation. For example, RNs are going to delegate to other RNs. They're going to delegate to LPNs. They might delegate to assisted personnel. Some key concepts. Nurses can only delegate tasks appropriate for the skill and education level of the healthcare provider who is receiving that assignment. So there are things that you cannot delegate. You cannot delegate nursing process, client education, or tasks that require clinical judgment to LPNs or assistive personnel. So again, this is where it can sometimes be a little bit tricky, especially for my LPNs who are out in current practice, because you might see a little bit of a difference in what you see done in some of the LPN roles. Okay, so there's things that nurses have to examine. What is the predictability of the outcome? So if I'm delegating a task, is this routine or is it a brand new treatment or a brand new intervention for this patient? What's the potential for harm? Is there a chance that something negative may happen? Again, is the patient stable or is the patient unstable? These things are going to change whether or not we delegate this. And does the person that we are delegating to, the delegatee, have the necessary skills to complete the task? Okay, this is key in the process of delegation. This is what's going to promote safe and effective care. So again, what is the complexity of the care? Again, is there a need for problem solving and innovation? So is there going to be a lot of judgments that have to be made when performing what I'm delegating? And is what I'm delegating, is there going to be a lot of interaction or a high level of interaction with the client, a lot of psychosocial support or a lot of education or new education that's going to be required for performing the task? So those are some of the pieces you have to think about when you're looking at delegation. Again, I will tell you, and this is a key concept, is when delegating and delegating inappropriately, you'll see inappropriate delegation when there is short staffing, okay? Especially when there is short staffing, we see inappropriate delegation. So the other thing that we really need to take into consideration before we go into these 5 rights of clinical delegation is how complex is the care? So what is the complexity of the care? So that's one of the largest factors. What's the complexity of the care? And one of the other things that's really important when you delegate anything is that you be available to help if needed. So when you are delegating, it's different than assigning. If I am assigning, I am transferring authority, like to another, when I'm giving shift report to another nurse and I'm leaving the facility, I'm assigning my patients to them and moving on, and I've relinquished myself from responsibility. But if I'm delegating something, remember, I stay responsible. I need to keep in mind the complexity of the care. And I know that when we have short staffing and optimal staffing, this is when inappropriate delegation is likely to occur. I will tell you, you will need to know these 5 rights of clinical delegation, and you will have to give an example of them on the leadership exam. The right task, right circumstance, right person, right communication, right feedback. So learn those 5, commit them to memory, and be able to know them as well as you know the principles of med administration. So again, the first thing we're going to talk about is the right task. So you identify the tasks that are appropriate to delegate for each specific client. So we're delegating activities that are appropriate to the levels of team members. So I gave you an example of, for each of these, what is an appropriate thing to do and what you should not delegate that falls under a right task. So a right task would be delegating to assisted personnel to assist a client who has pneumonia to a bedpan. However, the wrong task would be delegating to assisted personnel to administer a nebulizer to a client who has pneumonia. So again, that's looking at the right task. Right circumstance, because we want to look at the health status and the complexity of the care required by the client, and we're going to match that complexity of care with the skill level of the healthcare team member. We also, when we're delegating, we have to consider, what does my colleague also have in their workload? Are they already drowning, and am I delegating them even further tasks or things to do? Because remember, I still remain accountable. So something that would be a right circumstance would be delegating to an assisted personnel to assist in obtaining vital signs from a stable post-op patient. However, we're not going to delegate vital signs directly post-op to a patient who we just gave Narcan for respiratory depression. Yes, a CNA or an AP can get post-op vitals, but that Narcan for respiratory depression made that patient higher level of care or more complex. The right person, we want to assess and verify the competency of the healthcare team member. So you as the RN are going to be involved in reviewing the performance, making sure that they're competent, that they're doing the procedures correctly. You're going to assess team members' performance, remediate if necessary. So for example, you could delegate an LPN to administer an enteral feeding with a client with a head injury, but we wouldn't delegate to an AP to administer enteral feedings to a client who has had a head injury. So again, is it within their scope of practice? Right communication, this is really important. We either have to communicate in writing or we have to communicate orally. Exactly the data that needs to be collected, you have to come up with how and a timeline, the specific task, and expected results, timelines, and expectations. So for example, if you're delegating to your assistive personnel and you just told them to go give Mr. Smith in room 2 a bath, and at 2 o'clock you say, "Did you give Mr. Smith a bath?" And they say, "No, I haven't gotten to that yet." You can't be upset with them because maybe they did not prioritize that as a priority in their care. However, when you're delegating to avoid that, you can say, okay, I want the patient in room 2 showered by 9 a.m. and give them a list or expectations clear of what you want performed within a time frame and how you want to follow up communication with them. So again, it's just really going back to clear communication, key, absolutely key, either in writing or verbally. And the right supervision or evaluation, this can be used interchange. So again, if you're delegating, you're still supervising, you're still evaluating. You have to make sure you're clear with your directions and expectations, and make sure that you're monitoring performance, providing feedback. Intervene if necessary. You might have to intervene directly if you start seeing, say you see somebody doing a procedure wrong or not doing an intervention like they should be. So you are going to be key in the evaluative process. So examples of this: after completing admission assessment, the RN delegates to AP the task of ambulating client. So that is good because the RN has already assessed what if the patient is at risk for having any complications, how many assists are they, if there is any assistive devices. The wrong supervision would be before I even went in and saw that patient, I went ahead and told the assistive personnel to go ahead and start ambulating that client without knowing that patient's abilities. So the right supervision or evaluation is key. 4 C's of communication, very important. All communication, is it clear? Do you understand what I'm saying? Have them repeat it back for confirmation. Is it concise? Remember, too much information just confuses all of us. Is it correct? Are you following policy and procedure? Is it the job description? Is it within the Nurse Practice Acts of the state? And do they have all the information necessary to complete the task provided? So really important to know all those pieces. So a little bit of practice. We're an RN on a med-surg unit making assignments at the beginning of the shift. Which of the following tasks should the nurse delegate to the LPN? Okay, so a couple things. Just in your brain, there's a couple things I want you to just kind of commit to NCLEX delegation memory, that any initial teaching, any discharge, any care plans, any assessments, and certain IV medications are not done by anybody else other than the RN. So, for example, blood is not done by by LPNs. So you can already say we're not going to delegate any blood product administration. We're not going to do the instructing a patient performance of wound care because they can reinforce teaching, but they would never do initial teaching. So instructing or teaching is going to be an RN only. Also, developing a plan of care. So any plan of care development or discharge planning is going to be RN only. So again, what you could delegate in this would be 1, obtaining vital signs for the client who is 2-hour post-procedure following a cardiac cath. Question number 2, an LPN ending her shift reports to the RN that a newly hired assistive personnel has not calculated the intake and output for several clients. Which of the following actions should the RN take? So again, this question kind of looks at delegation plus conflict management. When you look at this, I would first ask the assistive personnel if assistance was needed to complete the I&O records. First, whenever there's, and we're going to get into our leadership with narration number 2. The second one, we're going to talk a little bit about conflict and communication. Again, this is one of the things that's important that we are going to actually really focus on. If we have communication delegation issues, we're going to address that first with that individual privately, in a private environment, non-threatening, so forth. Okay, so any questions that you have about time management, prioritization, and delegation, again, I'm going to make myself available during an additional Zoom lecture time that we will talk about this upcoming Monday. that we can actually go over. I put up on Blackboard, it's not pink, it's just clear. It's the assigning, delegating, and supervising care, and it's what you would assign an assisted personnel, an LPN, or an RN. So this is like an activity I think we can all get together on Zoom and go through and talk about some of the, if you look at all these skills. And then what I will do is I will fill out this and post it by the end of next week. Or I'll take a picture of it and upload it after I fill it out. But I think we could get together and discuss this so you guys have those key concepts with delegation available to you. Okay, so again, this is that I want to look at that because I want you to make sure that you have in your brain when you're taking any of these practice questions and they have to do with delegation and prioritization and time management, that you're using these basic principles when you're answering those questions so that you're sure about really what is the role of the RN, LPN, and assisted personnel. And one of the other things I want to say is because these roles can change state to state, we go by, and NCLEX is going to go by the national overarching standard. Remember, each state can make it a little bit more rules and make it a little bit more stringent, but we're going to look at some of the big pieces. And that's really what I see NCLEX doing is, you know that the RN does assessments. Now, your aide can collect data and give it to you. Your LPN can collect data and give it to you, but you're doing assessments. You're doing initial teaching, you're doing care planning, you're doing discharge planning. All of those things are directly RN responsibility. So if you keep some of those key concepts, you'll be able to answer those questions appropriately. Okay, so I'm out for a little bit. I'm gonna go take a few-minute break, get something to drink, feed my dogs, and then I will come back to you with the conflict and reality shock, and that will be in the Leadership 2 with narration that I will post later today. Talk to you later, guys. We miss you. Bye.